Hello everyone, my name is Masshara Binti Mohammad from batch 24. Today I will present a case presentation on chronic periapical abscess. Let's start. A 25-year-old gentleman came to the clinic with the following complaints. His chief complaint is the patient complains of pain in the upper right back tooth since last 2 weeks. The patient experienced the pain 2 weeks ago that woke him up at night. The pain was non-radiating and localized in the right upper back tooth with the visual analog score of 6/10. He described the pain as throbbing. The pain was aggravated by mastication. He sought for dental treatment from local dental clinic and was prescribed with paracetamol and antibiotic amoxicillin for 5 days. The pain subsided after taking paracetamol 2 days later. History of fever along with swelling in relation to the tooth of interest is present. Patient also provided history of pain after biting on hard bone 1 month ago, to which he was prescribed to use sensitivity toothpaste Colgate Pro Relief by his dentist. So now, moving on to the medical history, the patient takes amoxicillin for 5 days since last 2 weeks, to which he has completed the antibiotic course, and there are no other relevant medical history. His dental history reveals his last visit was last 2 weeks, where he came for a checkup on the tooth pain of the same region. The patient wears upper removable partial denture since 6 years ago. His oral hygiene and oral care history shows that he brushes twice daily with fluoridated toothpaste and soft bristled toothbrush. The patient also brushes the removable partial denture daily with the same toothbrush and toothpaste. The patient drinks alcohol only on occasions. General extraoral examination done on the patient shows the following results. The facial symmetry was symmetrical, the lymph nodes were non-palpable and non-tender, and the TMJ examination shows no clicking and no deviation. Next is the intraoral examination. Firstly, starting with the soft tissue and the oral mucosa. On inspection, right maxillary alveolar mucosa shows sinus opening in relation to 1/4, and on palpation, the patient feels pressure without any pain in the alveolar mucosa in relation to 1/4. The gingival and periodontal structures shows generalized gingival inflammation. The examination on the hard tissue shows the following. There were 29 teeth present. The tooth of interest is 1/4, showing ICDA score of 3.0 occlusally, 3.1 distally, and it has negative tenderness on percussion. However, it was tender on palpation and non-mobile. Sinus opening is seen in the alveolar mucosa. There were no mobile teeth, and non-carious lesion, which is attrition, is seen in 3.1 and 4.1. There were no root stumps and no fractured teeth. The discolored teeth is seen in relation to 1.1. Local factors were generalized food debris and calculus. The occlusion shows on the right side class 3 molar malocclusion with molar crossbite, and on the left side class 3 molar malocclusion. There were no other findings. So, after taking the history and doing the oral examination, there are 3 provisional diagnoses that can be drawn from this case. The first one is in relation to 1/4 is teeth caries with chronic periapical abscess. Secondly is skeletal class 3 malocclusion with right side molar crossbite. And lastly is chronic generalized gingivitis. To further confirm the diagnosis an imaging investigation is done, which is intraoral periapical radiograph on 1-4 and 1-2. The radiographic interpretation reveals in 1-4 there is a deep secondary caries and widened PDLs in the apical region, which is consistent to chronic apical periodontitis. In 1-2, there is missing 1-2, while 1-1, 2-1, and 1-3 are normal. These are the two IOPA which has been taken. The first one is the IOPA on 1-4 by using the bisecting angle technique, and the second one is the IOPA on 1-2 done by using paralleling technique. So, after correlating the clinical observation and the radiographic investigation, the final diagnosis that can be drawn from this case in relation to 1-4 is deep secondary caries with chronic periapical abscess. The treatment plan is, firstly, we do root canal treatment in relation to 1-4, and then to do orthodontic consultation and implant or fix partial denture in relation to 1-2. And that is all from me today. Thank you very much.